Welcome to the Health Workforce Technical Assistance Center's webinar series. This webinar is entitled A Review of State Correctional Facility and State County Mental Health Hospital Designation Criteria. It was presented by Scott Jones, Diane Roberts, and Robert Martiniano on May 24th, 2018.
Hello, good morning and good afternoon, depending on what part of the country you're in. My name is Robert Martiniano. I'm with the Center for Health Workforce Studies, and along with Scott Jones and Diane Roberts, Scott out of Nevada and Diane out of Illinois, we want to go over the state correctional HPSA rules and some helpful hints, hopefully, as well as the state and county mental hospital rules, and again, some helpful hints. Just some housekeeping. So we're going to have the chat panel open, so if you need some clarification as you go along, you can just send the question to, you can either do it to the host or to all panelists, and we'll get it and we'll try to answer it as we go along. So because there's so few of us, I think what I want to do is we're going to unmic everybody, unmute everybody, so that it'll be more of a free-for-all. So as you have questions, especially when we get to the question and answer period, you can kind of just shout them out. All right, so let's talk about today's webinar. So again, as I said, we're going to go over the state correctional facilities information, then the state and county mental hospitals information. One thing, actually, even though your mics are open, it would be useful if you kept your phones on mute until you wanted to talk. That way there won't be such feedback. Okay, so back to the webinar. So today what we're going to talk about is state correctional facilities. Again, we're going to go through the criteria. We're going to show you some screenshots and some of the ways we've each done, collected data, and analyzed data to help you. So what we thought we'd do is in two steps. We'll do the correctional facilities first. We'll go over some helpful hints, and then we're going to open it up for questions on state correctional facilities. And then we'll go into the state and county mental hospitals. So I'm hoping, given our time frames, that in general we'll have about 10 minutes left at the end to talk about any general questions. So I guess, you know what, and I'll kind of keep this open. Any questions before we get going? Okay. So first up is going to be Scott, who's going to be talking about the state correctional facilities. So just as an aside, that the criteria we're going to be talking about is right out of the policy manual that's available on the HRSA PCO portal. So again, a lot of the stuff we're taking is right off that documentation. We put the link here, and you can use it. Again, that's what we're quoting, but some of the other material that we're providing, things that we've done to help us in either data collection or analyzing the data. Scott, you're up.
Great. Hopefully everyone can hear me okay. Can everyone hear my voice?
Yeah, you're coming across fine.
Great. So one of the things about state correctional facilities is, as Robert was saying earlier, my first recommendation is that you read through the manual for policy and procedures that was on the previous slide, because it gives you some of these requirements, and it helps you to understand, even at an intake level, how you can help prevent having to collect all the data in certain cases for facilities that will just definitely not be able to apply to the program. So, you know, you have for all designations, if you're going to have these state correctional facilities, you have a minimum inmate population of 250, and these have to include medium or maximum security correctional facilities, as well as youth detention facilities. So these are actually new ones that we have recently started to analyze. But as I said, you probably first want to get an idea about the correctional facilities when you talk to the different representatives, because we found with one of the youth detention facilities that they have less than 250 in terms of the minimum inmate population, and so they immediately would not qualify. So we wouldn't have to continue trying to ask for data when we can use this initial data point to exclude them or include them. In terms of correctional facilities, there's a couple different things that you'll want to consider, and this is basically data that will affect the downstream score and will be required to complete an application. So you'll look at the length of stay, the average length of stay for the different inmates. If intake exams are mandatory, And we'll talk a little bit about how if you can find out about intake exams, you can use additional data that can sometimes get you a better score. But there is a minimum amount of data that you have to submit one of these applications. And then we have average number of total inmates per year, and then average number of new inmates per year. At the bottom here, we have some of the ratios that are minimum if there are providers at the site. So in certain cases, and we'll look at that a little bit later, if you have no providers, then you have less than these ratios. But these are kind of giving you an initial look at what kind of population to inmate population ratio that you'll need to have. And then if we can go on to the next slide. So for primary care, mental health, and dental health, there are slight differences in the equations that are used to calculate the scores. So we're going to start looking at primary care. So if you do not have information on need for the intake medical exams are not done, then the number of internees that get put into this calculation that help to actually determine the score for the facility is just the mean number of inmates per year. So that actually is if you have just that minimum piece of information and you don't have information about the intake medical exams. And then if we can go to the next slide. So then this next slide is going to go if you do have information regarding those intake exams, if they're routinely performed. And then you also have additional designations for the average length of stay for those inmates, and if it's greater than 1 year, then as you can see, you have this equation that is put into place to determine that mean number of inmates per year, and it includes the additional data as we talked about. Now, if the average length of stay is less than 1 year, then you can see here that you have a different equation that comes into play to actually determine the number of internees. And then you have in this equation is the mean length of stay, which is this ML0 or MLOS. And so in my mind, when I'm thinking about collecting data from these correctional centers, my immediate thought is to try to get as much data as I can. So if I can get information about these routine intake exams, if I can get this additional information, I'm going to want to get that information so that I can have that to see if it assists in getting a greater score. And Robert, I know you've done some equations with this, so I don't know if you had anything else you wanted to say about these equations that you find useful.
No, well, other than, and I'll talk about this in a little, but other than just watch out for your parentheses, because I've noticed as we were putting these in Excel, the parentheses are going to determine how good or how bad your information is. And we'll talk about that when we get to some of the stuff I've done.
Yeah, and so, and I will highlight that as you can see with this information, you have this mean number of inmates per year, and then you look at the new inmates per year, and that can get you additional number of internees. So some of these can really benefit your scores, and that's why I said it's best if possible to try to collect the maximum amount of information that's needed, even though it might not be required per se for these applications. So then you're going to see that there's two major parts that go into the score. We have this one here where we're looking at basically, I call it kind of that population to provider ratio if we look at other HPSAs, but you have institutions that have a certain inmate population compared to the providers that will serve them. And so you can get a degree of shortage points. You get more points if you have the, that lower score or the lower population to provider ratio, or in this case, if you have absolutely no providers on site. And that's one part of that score, as you can see, but then there's another part that actually has to do with the geographic score, HPSA score, in which the facility is located. And so it's important to recognize that the facility, a huge part of it is if that facility is located in a geographic HPSA. And you have to also understand that if it's in a low-income HPSA, it does not get these points. It has to specifically be a geographic HPSA. It has to be, in the case of primary care, a primary care geographic HPSA. And so what I will also say is it's good to start thinking about this early on in the process when you're having conversations with the correctional center staff, because, you can do some of these initial analyses to understand what the minimum inmate population is, or the minimum average inmate population is, and it needs to be greater than 250. But you can also look, are they in a geographic HPSA? And so you can see if there's going to be a priority for an application that's going to have a higher score and is going to be more competitive versus one if it's not in a geographic HPSA, that the maximum score it's going to be able to get is this 12. And so that might not be one that you prioritize unless for some reason you have programs that don't need a high HPSA score in order to access the funding. So then we also look at dental care. As you can see, it's quite similar. If you don't have data regarding the dental intake exams, your number of internees is going to be the mean number of inmates per year. And so that's similar to what primary care has. And then you look in here, and then we also have specific equations. If you have that additional data, whether the routine intake exams are performed, then as you can see, if the length of stay is greater than a year for the inmates, then you have a specific formula that creates the number of internees versus the length of stay that is less than 1 year. And I'm not sure if Robert will be able to, but I'm hoping that he might be able to share the Excel document that he created that actually allows you to then calculate projected scores with these equations correctly put inside of them. Because he referenced how if you don't basically calculate these correct in Excel, then that can get you inaccurate data. And so he's kind of gone through that and made sure that that data was correct. And you'll also see here that, between dental and primary care, there can be slight differences in these equations. And SDMS will automatically calculate this information. What I've historically done with my correctional centers is I input all the data and then I let SDMS actually do the calculations so that I can see what the projected scores are before I submit them. It might be a little bit better to do those in Excel because then you don't have to worry about working with SDMS and creating applications, but either way will work. If you're not an expert at Excel, you'll still be able to use SDMS, and if you have the Excel understanding, you can use these equations to kind of project what the scores will be. And as you can see here, they have a similar to primary care, the correctional facility score, it's an aggregated points based on this degree of shortage. It's based on the inmate to provider ratios, and then also the geographic HPSA score for the dental, for dental health HPSA is a huge component, so look at half and half. So mental health, you see a similar thing to primary care and dental health, that the number of internees is just that mean number of inmates per year. And then, similar to the other two that we talked about, I'm not going to go in this in depth, but then you'll also, if you collect that additional information with routine intake exams, then you can use this data to then calculate the score. And then, as I said before, then we also have here information about the aggregated points for that population to provider ratio, as well as the geographic score that will contribute to the final correctional facility score. Okay, and so as part of this also, I wanted to show you some screenshots for those who haven't created these in SDMS before, to let you know kind of how you access the applications and the type of data that you'll need to put in and what it looks like in the system. So, this is my login on the BHW program portal. When I click on this designations field, you can see on the right here, there's this facilities form. You'll click on that. Then you'll see here that you have to select, create a name, the discipline, and the type. You'll have to put into play. And so for those who haven't updated or created new correctional facilities, you'll need to create a separate score for primary care, mental health, and dental health if all of those services are provided. So, this can actually be a pretty big effort in terms of update. If you have, 5, 10, 15 facilities, you got to imagine that if each of those provide primary care, mental health, and dental services, that's going to multiply your work times 3 because you'll be doing a separate application for each one of those. As you can see here initially, when you open a facility form, you'll be able to input your facility name. You have to input the address, and then it's actually going to geocode, and it will tell you if it's successful. You'll actually see a map that comes up, and that's the first step that's needed because it does need to identify if that area is in a geographic HPSA or not. So this is a critical initial step in the process. So then, as I said, you'll put all this information in, and then you actually have to click this little geocode button, or it will not do it automatically. And then that processes and it populates this with a map, and then you just click Save and Continue, and it goes to the next tab. So with this, you'll select the correctional facility type, so that will be a medium, maximum, or youth detention facility. And then this is where I really recommend for anyone who hasn't done these before that you actually go on SDMS, you create one of these. As you can see, I just created one that I call Test, and actually go through and practice putting in all the data, recognize the data that you need for the applications, plan for the type of supporting documentation that you'll need. you can see below here you have the mean inmates per year, and you have a little star behind it. That means that both this and the routine intakes performed are required fields that you have to input. And so with routine intake exams performed, you can either put yes, no, or you can put unknown. And so if it's unknown, then as we talked about before, that's where it just defaults to your the mean number of inmates per year. And so you can see here that when you type in all this information, you can click the calculate button and it will get you that number of internees. And then within this field too, you're going to be defining if there's no providers at the site, or then you're going to actually be inputting the provider specifically. And so it's important that before you start this, you know exactly what providers are practicing at the site. You need their names because you're going to be looking up them within that SDMS environment based on their NPI numbers. So I just give an example here where we see that same screen, except I've actually selected a provider and it's shown up here. So you can see here, I'll click on that search for providers button, and then it comes up with this provider search pane. And so as you can see here, you can type in their NPI number, their first name, last name. These are all the fields that you have to search for the providers. And so what I will usually do is I will have a list that I get from the correctional centers of the names and as much information as they can provide about the providers. And then I actually search for them so that I can select them and then have them populated into this field here. And this field will show you which providers, practice at the site, their FTE. And this data is actually pulled directly from SDMS from the provider records. And so in certain cases, you might actually have to input those providers as correctional center providers and edit them outside of this in the provider part of SDMS before you can actually submit one of these applications, because it will pull the FTE information, and if it's a little different for the correctional centers, you want to make sure to have all of that data right for when you're putting together these applications. And so after you've selected all the different providers, you'll have a good list here of the providers that work at the facility, and then it will also give you the internee to provider FTE ratio. And so this is used to help that first half of the correctional center score that you see. And as I said before, you're going to need to validate and actually edit your providers in SDMS ahead of time. So this is an example where you're able to see, in this case, it's a psychiatrist where I edited the tour hours. I will have needed to add the correctional center address so that I have an entry specific to the correctional center there. And then I put a note here regarding these served at a correctional facility and served at a state or county mental hospital. I ran some tests before this, and I was initially thinking that maybe if you selected yes in either of these cases, that it would pull them out of SDMS and zero out their FTE. And I found that that wasn't correct in terms of these providers. They still maintained an FTE. And so one of the recommendations that I have, I don't know if this is going to be a fix or if they have another way that they handle this on the back end, but you just want to make sure that you be aware that when you create these providers, even if you identify them as a correctional facility provider, you might need to edit or remove them before you submit a geographic or low-income HPSA. So that's just a piece of advice. And my recommendation is that you do identify providers as correctional facility providers, because then that will allow you to easily identify them later when you're putting together a HPSA application. But I always am very careful to test and make sure that when I'm doing a geographic HPSA in the future, that these providers aren't being counted because they don't serve the general population. The other thing that I found that even if you do not select, serves a correctional facility, you can still search and find them in that correctional facility panel that I talked about earlier. And so this is, at least from what I was initially able to see, is not required to be able to connect them in that application. But as I said, I'd recommend selecting that in the case of a correctional facility or state county mental hospital, just so that you can identify them later. Okay, well, and this is one really useful reference that we wanted to send out regarding the actual Federal Register notice that gives information about the criteria for determining the correctional facility score. So this is where they actually, pull the information to be able to put together how these facilities are scored. And Diane and Robert might be able to talk a little bit more about the history behind this. As you can see, the effective date was before the time that I started, which was in 2014.
This is Diane. I would just say, yes, this was a big change that took place in 2012. And really changed how HPSA scores were calculated for correctional facilities. It actually had an adverse effect for scores for most of them. In fact, we had a lot of NHSE placements in correctional facilities prior to that, and pretty much lost them, pretty much lost that ability after this change. I don't know what else to say because I don't want to say something nasty.
I think you covered it, Diane.
Okay, good.
Yeah, and I would say I always recommend that, you know, if you're working in a PCO, you're doing these applications, you not only read the Manual for Policy and Procedures, but you go back to the actual documents so that you understand what it says in the Federal Register versus the MPP. I just think it's useful to have all of that information when you're doing this.
So we're actually going to switch directions a little. We've gone over kind of the process. So we're going to, the three of us have put on information that we think can help you kind of do your work now. So we're going to start with Diane. Go ahead, Diane.
Okay, this is just a sample of the form we have, and by the way, I have generic copies of these. If anyone emails me and they would like it, I'm happy to share with anyone. I have them for primary care, mental, and dental. And our situation in Illinois, years back, we used to have one point of contact that would get all this data for us for the correctional facilities, and that has changed. And so we really had to revise how we requested data so that whoever it came to, whether it was the mental health clinic administrator, the dental administrator, or different people at, we've got like over 25 prisons in Illinois. And, you know, of course, there's a potential for mental, dental, and primary care for all of those. So what I'm saying is, even though the guys on this call will show you that they get a lot of data and they are able to get it from sometimes one source and get it, we can't. So I tried to dumb down the form. This sounds nasty, but to get the information we needed from them. And also, I really only get the information I need. For instance, if they do not do intake exams on all of their inmates as they come in, then I do not request the optional information, just because I have a hard enough time just getting the data I want from our prisons that I don't ask for more than I need. So like I said, we have a form like this for each. Go ahead.
Okay, so in contrast to Diane, in New York State, we actually have one or two contacts. I had a mental health contact as well as a primary care contact, and they gave us all the information for all the prisons. We actually have, I think, 54 or 55 prisons. So I was able to, rather than have to survey each, I was able to, and they actually sent me a spreadsheet, and what I did with their spreadsheet was kind of expand upon it to have it do the work. So again, unlike Diane, who collected the information, and unlike Scott, I actually did this first, so I kind of knew what I was getting into before I even went into SPSS. And as you can see, and actually what you don't see is column A, so everything's off a little, but as you can see, I have whether or not they did the intake exam, whether they're medium or maximum security. I actually knocked out the minimum security just to make my formulas a little easier, but you could have put them in and I could have kind of expanded my formulas. And then all the rest of the information I just had in there. And also you'll notice I did length of stay both in terms of months and days. So it was, even though it was months I initially got, I recalculated to days because that's what SDMS asked for. And then right after length of stay, I actually was able to do the calculations. If no medical exam was done, intake was done, then obviously that is equal to the number of new inmates, which is the fifth column over. And you'll also notice I highlighted the columns because I actually had one of my staff do the forms, but they were working off this sheet. And the other thing you'll notice is on top I actually had columns 12 to 14. So not only did we get this in a spreadsheet, but we got the actual documentation. And so when we submitted this, I actually, again, I submitted not only this information, but I submitted the actual forms that the Department of Corrections sent me. And And then, so when I sent it in, I said, well, so if you look at this piece of paper, column 14, rows 3 to 5, you'll find your, facility I'm referencing. So it was kind of, again, it was, and when I did this, I was looking at that, should I leave it in or take it out? But again, I left it in just for you to understand that there's also backup documentation. Go ahead.
I was just going to say that's a good point to bring up. With SDMS, we do have to upload supporting documentation for each correctional facility application. And I think it's like a lot of things, it depends on your project officer. For mine, I can just upload the actual worksheet that I got with the information from the correctional facility. So hopefully, I think there's, but you do have to do that now, whereas in the past, prior to SDMS, we could just enter the data in.
Okay. So again, so no intakes, medical intakes when length of stay is 365 days plus or less than 365. I actually wrote formulas, and you'll see one relates to no medical intakes, 2 relates to where length of stay is greater than 365, and 3 is related to where length of stay is less than 365. And actually, you'll see the if error. So why I did that was they actually all, if it didn't qualify, rather than give me a false, it just leaves it blank. And then where it says census, I actually just said add the 3 together. And obviously, since I got blank, it just gave me the right number. And then what you don't see is actually on the other end is FTEs. So I calculated the ratios right there. And then I can look and say, well, given what I have, I see the ratio that qualifies or doesn't qualify, and I can move on and then put them in the thing. One of the things that I did, and as I said when Scott was talking about it, the parentheses are extremely important as you write your formulas, because the first time I did number 3, my parentheses weren't in the right place and I didn't get the right information. So what I actually did was did a test on SDMS to make sure I knew what number I had to come out with, and then I made sure I had the parentheses where they were. And as with Scott, I can and Diane, I'm more than happy to share this information to help anybody who needs it. Okay, so we have a question here. I'm going to stop for a second. And the question is from Tom Rauner. How long does it take once one has received information back from the correctional facility on providers, updating them in SDMS, and then being able to prepare an application with the updated information? Diane, Scott, you want to answer that?
The question was, how long does it take to process an application once we get the data?
Pretty much, yes. Tom, are we interpreting that correctly? And you can talk if you want.
Sure. Yeah, I think the big thing is here, I assume it's the same amount of time as updating any provider in SDMS. I believe that's usually at least the next day before that's,
I see what you're asking. Yeah.
Oh, the providers.
Yeah, actually, that's a good question. So, and again, Scott and I did it a little differently. So I actually go in so once I've done this, if I feel that they qualify, then I go in and fix the providers before I even go into the application to do this. So then, yeah, it would take a couple of days. But for this process, it takes, half hour or an hour, depending on how good my coding is.
Well, go ahead, Scott.
Oh, sorry. I would just say I would recommend, as Robert was saying, to update all your providers, and then as Tom was saying, wait a day. Make sure that they're actually correct, and then double check them that the hours and everything are reporting correct when you select the providers in the application.
Good point. Yeah. So I mean, I went in and put the appropriate hours for the prisons, and then if I needed to zero out other hours, or if that was the only place and I saw multiple addresses, obviously go in and zero out, and I forget the term, but basically if they're no longer there.
Yeah, make them ineligible if they were in there wrong, right?
Correct.
But yeah, I mean, these are fast. I mean, compared to other HIPS applications, these are fast, and I want to let the audience know it's nice to know the calculations that go on behind your processing here, but you don't need to know this. I mean, you can just plug in your number of internees, the responses from your, like on the worksheet, and plug them in and let SDMS do the calc. So it just depends on your workload and your staffing. It is nice to have an understanding of how SDMS does it, but really, you can just plop the numbers in and let SDMS come out with your total. Thanks.
Yeah, I mean, good point. And I think New York has 54 or 55 prisons, and so if I'm doing it for all three, it's going to take some time. So I wanted to kind of do a shortcut. But you're right, if you've got 2 or 3 prisons, it may make sense just to go through and do it. We got another question from Casey out of Idaho. Is any documentation required to support the medium maximum security status, or will an attestation completed form from the facility suffice? Scott or Diane? Or anybody else? I mean, if anybody else has done that, please chirp in too. So
this is Scott. What I'll say is I submitted a whole set of these, about 21 of the applications this last, I guess it was a year or 2 ago, and I just gave the template that I had that just said medium or maximum, and it was accepted and the applications were updated. So with my project officer, that was what was required. As we'll say later, it's good to just check in with your project officer, maybe a little beforehand, show them what you're going to send to them and just make sure that they're okay with it. I find that's nice because if you submit an application and then there's something wrong with it, it can take a while to have it get, ping pong back and forth.
I also asked my project officer what he needed for documentation, and he would basically just take an email that had the data in it. It wasn't as formal as an attestation or anything like that, but it does depend on your project officer.
And I didn't ask my project officer, but the material I got from my Department of Corrections actually listed medium, maximum, minimum, whatnot. So I actually and that was one of the documents I had to upload anyways for some of the other information. So it was there and I had it. All right, why don't we go to the Scott's example. Go ahead, Scott.
Yeah, and so as Diane was saying, with us, we have a single medical director contact for all of our state correctional centers, and so we get one document, and this is just a data document where we get the data, and then what I do is as Diane was talking about, I let SDMS do all the calculations when I'm testing it. So as you can see here, they've set a prioritization grid for which ones they think they have the biggest recruitment problems with. This was actually developed in concert with the medical director, and so I find that's helpful too if you're starting out doing new scores for facilities you haven't worked with before. You want to work with them to try to make the data entry as easy as possible. As Diane was saying, we've had the same issue where it's hard to get data, so make it as easy as possible. What's nice about this is it's all within one Excel document. You have medical, dental, psychiatry. We basically just send this to them every time it needs to be updated, and then they just put new data in as needed. So you can see here we have the addresses of all the different prisons. We have in this case, you'll see it's dentistry, so they'll put in the names. I put A, B, and C to protect the dentists that are there. But all the different dentist names will be there at the different locations, as well as their hours. I want to highlight, though, that we recently asked them to do face-to-face hours and not just the FTE, and that actually has resulted in a significant decrease in the FTEs. So I would definitely recommend that if you clarify to them that you don't just want the FTE of the dentist, because that will, or doctors, that will usually greatly overestimate the actual face-to-face patient care that they provide. As you can see here, then also we have a row for dental assistants or hygienists, because this is what you need to actually completely validate a provider. And then we have whether the facility is an intake center, meaning they complete the intake evaluations. In our state, only 3 of the facilities do intake and do the evaluations before they get sent off to other facilities. And then below here you can see they have average lengths of stays, and then we just take an average of their average because they give us a range, and then they have, their average number of inmates. And then they also have a spot here where they talk about some of the admissions and departures, how they're not tracked by facility, but overall they fit into these ranges. So I try to get the best data, the most specific data, but as you can see here, I just have to take this and average it out across the facilities. So, my recommendation is that you sit down with these providers or talk to them on the phone, talk with the medical director or whoever your contact is, to make sure that you can get the data that you need, and maybe they just need it to provide it in a little bit different format. Well, the other thing that I found was quite interesting is when they reported these provider names to us, some of them actually I could not find an SDMS because they're not assigned an NPI number, because they're not required to have an NPI number to work at these correctional facilities. And so you might run into that where you can't actually put a provider into SDMS because there's no provider. And I know Tom years ago talked about this, and they didn't believe it, but it is true that there are certain providers that you won't be able to actually input into the system.
Absolutely right, Scott. I ran into that with my updates, too. I ran into 2 providers. So apparently those providers never were interested in providing Medicare services, huh? And that's why they never got an NPI?
Yeah, I mean, I asked them, you know, what the story was, and they just said, well, these providers didn't need one, so they didn't get one, and they don't have one. And so, you know, and it works out. I mean, you get a higher score, so. But
correct.
I wish that there was a way. I wish there was a way that you could input them into the system because we have the data. It's just not presently possible.
Okay, so I want to stop here for a second. We've got some questions, so continue with prison information. So the first question is, what do you share back with your facilities regarding their designation status? Are you attempting to let them know if they will or will not qualify for National Service Corps, National Service Corps scholarships or state loan repayment? And then part 2, do you follow up with any of them with other steps, becoming an approved NHSC site or whatever the state may require for state loan repayment? Diane or Scott, thoughts?
Well, I always go back to them. I'm sorry, I always go back to the contact with whether or not their application will pass and tell them I will be notified of the status of the HPSA. I really haven't given them guidance on whether or not they'd be eligible for NHSC. We've got several. Mental health was about the only ones that we could get high enough scores that are eligible for NHSC, but certainly we could let them know that and encourage them to do so.
Yeah, and what I'll say is that all of the facilities that we have here, they're all NHSC approved sites already, but if we had new ones that did not have sites, we would then try to help them through the process if they had a, you know, competitive enough score. If they had a score of like a 10, I wouldn't be pushing them to become an NHSC approved site unless they really wanted to become one. Sometimes it's helpful to get them approved, but it can sometimes also be very discouraging if they become approved, they have providers apply, and they just get denied because their score is too low. In our state, we also have a state loan repayment program that allows for any HPSA score to be accepted, and so it's useful for them to have these HPSAs, and we can tell them to use the state loan repayment program if their score is not high enough.
Yeah, you know, it's interesting as I read the question, I do that, but not necessarily in those steps. So a lot of times I get questions, what do we qualify for? And I go through, you know, what's your score, what you qualify, whether it's a federal or state program. This was actually the first time we've done prisons, so I haven't been to that step where you've been approved and we're going to go on to the next step. But I think that's a good thing to do, is to actually, you know, say, here's what you were approved, here's your score, and here's what you can do. We are doing that for other type of designations, that once we receive it, we go back to the contact we were working with and say, you know, by the way, you were approved, here's your score. And then we can work with them. We've got another question. I got to put my glasses back on. We have not specified on our correctional facility form what services, either primary care, mental health, or dental health, are covered under intake exam. Moving forward, is this something that we should tease out? It doesn't look like the MPP specifies. Yes, I mean, again, because I didn't do an intake form, I was actually, in New York State, they actually have policies around this, and like Scott's prisons, there's only, I think, 6 prisons that actually do intake. So when I did, going back to my form, you'll actually see the ones that are yeses, only about 6 are yeses, although you only see about half the things, and the rest of them are no's. So I knew which ones based on their policy, and actually when I submitted this, I also submitted that policy with our documentation saying these are the only ones that provide intake. But I guess from my point of view, it's necessary. Scott, Diane, or again, or anybody else, thoughts?
I mean, my thought is that I would definitely get that clarification. In the case of ours, they let us know that the intakes can do all 3 different disciplines, and so those centers are considered for mental health, dental, and primary care. But I think it's always good to have more data if you can have access to it because it can get you a higher score.
I agree. They may do intake for one discipline and not for the others.
Good point. Okay, so what I'd like to do is spend some time, it's probably not as much on, whoops, wrong way, there we go, on state and county mental health hospitals. So unlike, and I've done a number of these, unlike prisons, I've actually done a number of these. And so a couple of things you have to think about. One, you need a minimum daily census of 100. So if they're not even at 100, you don't even have the conversation. 2, and you're considering, unlike everything else we do, you're considering outpatient and inpatient services to get your workforce score. And I've actually, as you can see, I've actually included the formula. And to qualify, you need to at least have 300 to 1 workload units per FTE psychiatrist. So here's the scoring, and again, it's you've seen kind of this. Based on where your ratio is, you're going to get 20, 16, 12, or 8 points. Unlike the prisons, there's no corresponding geographic HPSA that can increase your score. So whatever you get, you get. So as with Scott, and actually these are Scott's outtakes, we wanted to go through a little of how processing in an SDMS, and again, very similar to the prisons, the first thing you do is put down a name, you identify the discipline and the type, and in this case, state and county mental health hospital. Then you go to the facility name and the address, and as Scott indicated, for prisons, geocode it so you can understand where they are. And again, as I said with the prisons, I actually go through the process and put in the psychiatrist first and clean that up first before I even go through the SDMS. So I already know whether or not they're going to qualify. And so I'm fixing that already. And same thing as with prisons, you get all the information you can put in. And what I want to do is talk a little about what information I collect, because this is not as straightforward as it may seem, depending on how they're defining inpatient and outpatient units. So they ask for the average daily census, the number of inpatient admissions per year, the number of admissions to daycare or other outpatient services, and then they calculate your workforce workload units, again, and you need at least 300 to 1, and then the number of psychiatrists. And of course, as with prisons, you're going to make sure that your address that's on the psychiatric center or the psychiatric hospital matches to the address that the psychiatrist has. And here's just an example of a list of psychiatrists that are, for a psychiatric hospital. So just a couple of things. So one of the things that I have access to that may be useful for different states is I actually work with other people to get the J1 list and to get the NHSC list, which I know we all have access to. So that way I'm not asking for that information, although I could. And that way when we're putting psychiatrists or any other providers into the database, we already have that information, so we're putting it in and not worrying about it. But as you can see here, the psychiatrists are all linked to that facility, if you can see the addresses, and all with their FTEs, the number of hours they spend or the portion of the hours they spent at that site. So as I said, I've been doing these hospitals for probably 10 or 15 years easily, and I asked for a lot more than I need to, and there's a reason I did that, because what I found that there were certain units that I was excluding from the analysis. So one hospital told me they had a consultation at the local jail that it wasn't even at the site, it was at the jail, and it didn't necessarily result in an admission to the hospital. It was just, and sometimes the consultation was with the judge, not even with a patient. So I excluded them, and because I asked for the FTEs by the different units, I knew to not only not consider any visits, but also not consider the FTEs associated with that. So again, I probably went a little further than I needed to, but it gave me much more data that I had some flexibility in looking at that, saying this is not a unit at that site that I need to consider. And then the other thing may be a comprehensive psychiatric exam program that has some inpatient, some outpatient. You may want to, again, only count a piece of it and a part of it. So let's stop here for a second and see if we have any questions regarding state and county mental health hospitals. And again, your mics are open, so all you have to do is unmute yourself and ask your question or send it through the chat box. All right, so nothing on the chat box? Okay. So let's just go to the next slide. So we've kind of given you some hints about how we've done things, and I know everybody does things differently, and I think that's important to understand that not only the three of us, but there are many other PCOs out there that have done this that weren't involved in the call today, that I think have done this in a different way from even the three of us, that I think you can use as a resource. So we really did want to kind of, not only give you, how we do things, but maybe some lessons learned and some recommendations on where we think you might want to do things. So the first one is review the policy manual and procedures regarding the HPSAS carefully. And, again, I hadn't done prisons in a while, and so when I started doing them, I mean, I had the manual open. I actually printed it out. I had it open. I'm going, all right, how to do the formula, how to put the formula in. And that was actually one of the first things I realized, as I said, was where the parentheses needed to be, and I looked at it and made sure that I understood what they were asking for. Practice creating an application in SPSS to get an idea of the data you will need. And I actually did that for two reasons. One, well, actually three reasons. One is to just get practice, doing a prison, which I hadn't done before. Two, to understand if my formulas in my Excel sheet were correct. So I actually, again, ran them and said, all right, I created a test facility, ran them and say, okay, my formulas are correct. And actually in one case it was incorrect. I had to fix my parentheses I was talking about. The third thing I did is I went to my project officer and said, look, I've never done a prison application before. I would really like to submit this, have you look at it and tell me where you think, I'm falling short on the information I'm sending you. It was a little proactive and probably asking for, too much, but they did do that, and they got back with me with a couple of suggestions about how I could improve the application, just so I knew that I was going to, when I did ultimately submit my 40 or so that I submitted, that I knew I had everything in place so that I didn't have to worry about them being sent back. Use face-to-face patient care for FTEs. Again, with everything, just make sure your hours are correct. And as you saw with Diane, she asked for, on her sheet, when I reached out to my, the people at the Department of Corrections, I said, I sent an email saying, all right, here's what I need. I need patient care hours. If you, tell me how many hours they work or what their FTEs are and what they're not doing. And so when I got information back on the spreadsheet, it said, here's where the patient care hours I had, and the FTEs. So then I could just plug it into my sheet. Scott, how did you collect FTEs for prisons?
So in terms of like how I got that data from them?
Yes.
So I just asked the medical director, and they actually on my template will report every doctor that's there and the hours that are there.
All right, so similar to what I did, okay. I kind of guess that. All right.
And that's nice. And that's nice because then you have one source that you can say you really only need direct patient care or face-to-face hours, whereas my state, they're fanning out to all these people, and I was getting too high of numbers, and so that's why, they're telling me they're working 50, 55 hours, and I had to go back to them and say, does this include admin hours and so on to get it down to what their actual appropriate tour hours for FTE were. One other thing I wanted to share with the group is how, the examples that Scott walked through here, Scott and Robert, show creating a new prison, a new correctional facility or a mental health center, but it's much the same as when you update your other HPSAs. You can pull up the existing HPSA designation, select update, and it'll bring you through the same screens we showed you today, and then you will need to confirm the geographic location and update the providers in it and so on.
Great. Okay. So continuing with recommendations, if possible, meet with the facility representative in person to discuss the process. I mean, I actually, I did that when I reached out to the Department of Corrections in New York. I actually reached out to them several times, talked to them about who I was, why I was doing what I was doing, and then it took probably a couple of meetings, every other week or so to get them comfortable with what I needed. And then, I said, as we discussed, here's what I need. But I think it's important to build those relationships so they know, why you need the data and how they can help you. And again, that also meant that when I asked for the documentation, I didn't have a problem with that. Any thoughts from Scott or Diane?
I mean, for our state, it's very feasible because it's just one person. Some states that have more, it might be a little more challenging to meet with the people. But I found in our state we could talk through the whole process, and it was for someone who just started that was new, and they weren't kind of clueless why we were requesting all this data.
Great. Yeah. And I think it's important, as we do all this work, whether it's these centers or the hospitals or, FQHCs, just to have people know who you are, not that they don't, but. Okay, so data. We've talked about data a lot here. Just request, the data you think you need, or maybe even more than you think you need, just so you're not going back to them 3 or 4 times, and also that you'll have all the information you need to do these applications. And as all 3 of us talked about, we collect data in various different ways, but we're all getting ultimately at the same, ultimately we get the same data to use in these applications. And finally, check with your project officer on supporting documentation. As you actually heard from the 3 of us, we actually all did it a different way, partly after talking to our project officers. So, I erred on the side of providing more data and sent them everything, the sheets, what column it was in, that they could verify the prison number of inmates and the length of stay. But again, as Diane and Scott said, they sent something that was actually the spreadsheet that said the same thing. Diane, Scott, any thoughts?
Nope, I thought this was good information that you shared. Thank you.
And the only thing I would add is just we just tried to do a state mental hospital application, and we got all of the data. We requested everything from them, and then we found out that they didn't have the minimum inpatient census. And so one of the things I would recommend is just to do an initial assessment of the hospital and ask for some of that initial information before you ask them for all the provider FP and all that additional data, because they'll just end up kind of wasting their time getting it for you, where you can sometimes tell them that they won't qualify on the front end with some really easy to get data.
Scott, that's a very good point. I actually had a psychiatric hospital that probably 5 or 6 years ago had over 100, and then as they downsized and eliminated some units and turned them into outpatient, they dropped below 100. So when they got back to me, so when I was talking to them, first question I asked, do you have 100? And they go, no, we're down to 60. So then I started having a conversation, well, then we can do an OFAC. So it's a whole different issue. But it's good to have those basics, whether it's the 100 for the psych hospitals or the 250 and minimum and maximum for the prisons, just so you don't have to go back and forth on things. We do have a few minutes if people have other questions about either the prisons or the state or county mental health hospitals.
Robert, this is Tom. I just had a quick question. Is there a possibility as far as when you were saying, doing the facility one versus the OFAC then, is that, do you want to go through just kind of a really brief, decision process for that, what you do?
Yeah, I mean, for state and county mental health hospitals, so if they don't, essentially if they didn't qualify for the 100, then I'd have to ask them what just look at their outpatient services and their FTEs and see if they'd qualify for that. Because they're still a not-for-profit, and they're still going to, still qualify under that. So again, I give them the option. Kind of when I do general area, designations, I kind of start with, Do you qualify as a geographic? If not a geographic, can we do a, some kind of special POP? And in some cases, then I've said, wait, you're a specific facility. You didn't qualify for the first two. So can we do a facility designation and other facility designation? So are you a non-for-profit? What's your FTEs and what's your outpatient? So I kind of walk through them, what the different criteria are and what they would qualify for and how they would qualify. I don't know, Tom, did that answer your question?
Yes, thank you.
You're welcome. Is it possible to receive a copy of the slides? Yes, we will put the slides up. We actually are going to put the whole webinar up at some point, but we'll put the slides up and then we're going to archive the webinar so you can actually hear your questions and our answers. So that pit way. And again, if people, the last slide actually has our contact information. So I'm also, it didn't come out all that well. So what I'm also going to do is I'll talk to Scott and Diane about putting our examples up on the website that we have, and I'll send that link out to people so they can see examples. Oh, and Morgan just put up where the slides can be found. So I will make sure that we send that out so the slides can be found, and as well as, again, we're going to archive the webinar so people can hear. Any other questions? So we're right at an hour, and I know we're all busy doing HPSA designations because we got that July 2nd deadline. So I want to thank Scott and Diane for helping on this and working on this. It was more than help. They worked on this, and I hope we have helped you in doing these designations. And please reach out to any of the three of us, or when we're in, when we're in Bethesda in 3 weeks or so, 4 weeks or so, we can continue this conversation, and we'll send you information if you need it also. Thanks, everybody, and have a good afternoon and evening.
Thank you.
And thank you out there for attending our webinar. Just to let you know, we will be posting our slides shortly to our website. So if you want to download them, check back very quickly at healthworkforceta.org. We hope to see you again in the future. Thank you, and have a good day.